Hi, everyone. I'm Dr. Joey Adashek. I'm president of the Nevada State Medical Association. I'm also a maternal fetal medicine specialist. I want to talk to you today about a bill going before the state legislature here in Nevada. It's Senate Bill number 344. So what does it do? It helps cover the cost of a test that's performed on pregnant women known as non-invasive prenatal testing. So what is that? So just a little background. When a woman is pregnant, that baby has risk for many different things that we look for during the pregnancy. And one of them is fetal chromosome abnormalities, where there can be an abnormal amount of chromosomes, number 13, number 18, and number 21. So in the old days, what we used to have to do is we would do a blood test, say around second trimester, and we would find out if there's an increased risk for the baby to have chromosome defects. The problem is with the old test, there's lots of false positives, meaning the test said, ooh, the baby had abnormalities, but the baby didn't. Or a lot of false negatives, where it said, no, the baby's fine, and the baby wasn't fine. So in the old days, we would have to do a great deal of amniocentesis. And an amniocentesis is where we stick a needle into the belly of the mom and take out a sample of amniotic fluid around the baby. It's uncomfortable, it can increase miscarriage rate, but that was the only way to check for sure, okay? Now, it is still the only way to check positively, but the thing is we now have a screening test that we can do as early as 10 weeks along to look for these chromosome abnormalities of the babies. It's called non-invasive prenatal testing. So at 10, 11 weeks, the mom gets a blood test, and with 90 to 95% efficacy, it can say if the baby has any of those severe chromosome abnormalities. And don't forget, these can be lethal, these chromosome abnormalities. So it's not usually something other than Down syndrome, but otherwise, the other ones are lethal, okay? And with this early screening, we can find out as early as 10 or 11 weeks if the baby has these chromosome defects. It has been a game changer all over the world. So many states in this country right now are covering it. Many insurances are covering it. However, not in Nevada. And this is what this bill does, is it will help defray the costs of having these tests performed, because it will mandate insurance companies cover this test. So we no longer are just practicing medicine on these pregnant women with doing inferior tests that are less accurate, that increase the chances of the mom having a painful procedure to look for these chromosome abnormalities. No more. So what can you do if you're at home? All you have to do is Google Senate Bill 344, State of Nevada. It'll take you to the website, and it will show you when they are meeting, and it will show you how to call and give your testimony, because many people out there listening to this will have had baby with chromosome defects, and when they find out that the baby is a lethal chromosome defect, but it's 21, 22 weeks along, and it's too late to do anything about it, and they don't find out till delivery, it's just horrible for our patients. So please, please look into this and give your testimony. Thank you all for listening. Bye-bye.